Hi, I'm Lisa Wahl. I'm a family nurse practitioner and I work at Providence Abuse Intervention Center in Lacey, Washington, where I've been a forensic nurse examiner and nurse practitioner for the past 18 years. Our clinic sees children who are referred to us through law enforcement, child protective services, and other healthcare providers. So, my passion is to be able to bring to the larger community an opportunity to prevent child sexual abuse in the first place. I mean, think of a vision of a world where children are able to grow up free of fear and shame and stigma of a experienced abuse in childhood. Some children end up spending the rest of their lives trying to overcome their experiences of child sexual abuse. We know that prevention is possible. We know that it's the adult's job to help prevent child sexual abuse. And as a trained facilitator of Darkness to Light, we offer stewards of children preventing child sexual abuse in in your community. We know that everybody has an opportunity, has a chance. Anybody who works with children can be that person who intervenes, who steps in, who takes responsibility, who prevents something to happening in the first place. A lot goes into nothing happened. And that's my goal, is to teach people at all places to be able to help them understand how they too can be that person to support children in our community. The information that we provide is a simple, proactive process, 5 simple steps to engage the person, to allow them to understand that, yes, we can. Yes, we do have the right. Yes, we know how to take responsibility, to act responsibly, to be able to mitigate child sexual abuse. Simple, right now opportunities that they can do to help prevent child sexual abuse is teach kids the correct names of their body parts. Use correct anatomical terminology. It takes the power, it takes the stigma out of it when we use the correct body terminology. And when a child needs to make a disclosure, they're able to use the correct anatomy. We want to know, let kids know that they have the right to say no to any kind of unwanted touch. And that's if they did make a disclosure, they're going to recognize somebody broke my boundaries, somebody touched me in an unwanted way. I can report that and it will be acted on. Be that trusted adult. If a child comes to you and talks to you about something that's happened to their body, let them know that they can talk to you without fear and without blame or shame. And just let's talk about minimizing opportunity. My gosh, I have gone to so many places and trainings, and I've gone a little bit early and I've done a little bit of looking around, and I always find a spot, a place, a nook, a cranny where there's no cameras. Those doors are closed. There's no window on that door to be able to see in, to be able to have an observed event that can be interrupted. We want to interrupt those one on one opportunities for child sexual abuse to happen. It can happen very quickly from the door to the car, from the car to the door. When I'm talking about reporting child sexual abuse, you're reacting responsibly. So, something has happened. There's been suspicion of child sexual abuse, there's been discovery of child sexual abuse, or there's been a disclosure of child sexual abuse. When you have suspicion, when you have a disclosure made to you directly, or when you've come upon something, whether it's video or whether you've opened the door and you've seen something, you wanna know how to support that child in the moment. What's that look like? That looks like being calm. Don't ask direct questions. Ask open-ended questions if they're willing to talk about it. Something as simple as, "Tell me more," or, "And then what happened?" And then know who to report that to. Make sure that child knows that they're believed and they're protected. We know that the best case long-term mental health outcomes for children who've been sexually abused are when the parent or caregiver supported them, protected them, and believed them. We know that 1 in 4 girls and 1 in 6 boys are sexually abused by the time they're 18. We know that the average age of disclosure of child sexual abuse is 52. We know that when a child is sexually abused, 9 out of 10 never tell prior to their 18th birthday. We know that when a child does disclose and they are not believed, that you will probably never hear that child disclose again because they are not safe. We know that children who have been abused have much higher rates of the alphabet soup of ADD, ODD, ADHD, all the things that really is a child's brain is affected by trauma. We know that adversities of childhood impact the long-term health and welfare of that child moving into adulthood. We know that children who face adversity in childhood end up having exponentially higher rates of health issues, mental health issues, and early death. We know that if we can provide a child with a safe and happy childhood, that we are providing our society with informed, empathic, able adults who then will not be reliant on systems, who will be able to function in society, who will be able to then parent well and pass on. We're going to interrupt intergenerational abuses and allow a society to grow and prosper